I welcome all in today's lecture on pathology. First, I want to introduce myself. I am Professor Shamsuzzaman, Professor and Head, Department of Pathology, Rangpur Community Medical College, Rangpur, and immediate past Professor and Head, Department of Pathology, Rangpur Medical College. First, we have to know what is pathology. You see, pathology is a dissyllable word. It has two parts. One is pathos. It means sufferings. It means sufferings. And logos. It means knowledge. So, what is pathology? Pathology is a medical science. It is medical science that deals with what? It deals with etiology of disease. Pathogenesis of disease. It deals with morphologic changes in disease. Morphologic changes. Changes in disease, and it also deals with clinical significance of disease. Clinical significance of disease. So, the subject that deals with etiology of disease, pathogenesis of disease, morphologic changes in disease, and clinical significance of disease is called pathology. Is called pathology. We want to know what is etiology. You know, etiology means causes of disease. Causes of disease. The causes of disease again is divided as two. One is intrinsic, there is genetic factors, and also acquired. This etiology may be intrinsic, that is genetic factor, and it may be acquired. Acquired means virus, bacteria, etc., etc. Now come to pathogenesis. Pathogenesis, I have told you pathos means sufferings. Pathogenesis, how the sufferings is produced. I mean pathogenesis means mechanism of disease. In other words, it is mechanism of disease. Mechanism of disease. Next, morphologic changes. Morphologic changes. What it means? Whatever may be the cause of disease, whatever may be the etiology of disease. Suppose somebody is suffering from viral hepatitis. It is etiology is the virus, either A, B, C, etc. The etiology is virus. And pathogenesis means how the viral hepatitis is produced. What changes occur in the liver? What is the mechanism of that change? What reflection you get in blood in viral hepatitis? How this reflection is produced? This is nothing but the pathogenesis. Now come to morphologic changes. If anybody suffers from viral hepatitis, cause is virus, and there is development of disease, mechanism of disease, and there is certain changes both in cellular level and also in the tissue in the liver. The changes either in the cell or the tissue is nothing but the morphologic changes. Now come to clinical significance. What it means? It means again we can cite that example. If anybody suffers from viral hepatitis caused by virus, there is morphologic changes within the hepatocyte and on the tissue of the liver. And due to morphologic changes either in the cell or in the tissue, there are some functional derangement of the liver. This functional derangement is associated with the sign and symptoms. This functional derangement of the cell and tissue is associated with sign and symptoms, and these sign and symptoms is due to the clinical significance. So again we can recall the alteration or morphologic changes in the cell and tissue is associated with sign and symptoms of the disease. So this is pathology briefly. Again we can recall, suppose this is a liver. It is composed of many cells, you know. First we can say liver is composed of a lot of hepatic lobules, and in between 3 hepatic lobules there is portal triad. If liver is infected by virus, suppose it is infected by virus A, so this is the causative agent, and there will be pathogenesis, and there will be cellular and tissue changes. These cellular changes and tissue changes is associated with the sign and symptoms. So if anybody suffers from viral hepatitis, all the hepatocytes are involved. So the change that occurs in the liver, all changes we can get in the all cells of the liver. So if we can study single cell of liver, that is, if we can study single hepatocyte in viral hepatitis, we can say the changes that we will get in the single cell, single hepatocyte, all changes will get in all cells of the liver. If it is true, we can say, but we can understand the cellular pathology. If we know the pathology or sufferings or alterations within a single hepatocyte, we can say this is the change of the entire liver. So now come to cellular pathology. Suppose this is a cell, this is nucleus, and this is cytoplasm containing organelles. If we can study the changes that occur in the cell, we can say all changes occurs within the liver. আমরা একটা ছোট্ট বাংলা কথা বলতে পারি যে একটা ভাতের হাড়ির মধ্যে ভাত হয়েছে কিনা প্রত্যেকটা ভাত আমাকে টিপে দেখার দরকার নেই, আমাদের একটা ভাত টিপে দেখতে পারি, বলতে পারবো সব ভাতগুলো হয়েছে কিনা, জাস্ট লাইক দিস. Now going to cellular pathology, we have to know, we have to recapitulate what is cell. আমরা জানি cell is the structural and functional unit of tissue, organ, etc. A cell, if the function of the cell is all right, and if the anatomical structure of the architecture of the cell is all right, we can say the cell is anatomically and physiologically and biochemically in normal state. And we can disturb the cell. আমরা এই সেলটাকে ডিস্টার্ব করতে পারি. When we disturb the cell, there may be development of pathology or other things. So how can we disturb the cell? Before that, we have to know what are the types of cells in our body according to power of replication. So before going to discuss about the cellular pathology, we have to know what are the different types of cell in our body based on their power of replication. Based on power of replication, replication cells are three types. One is labile cell. Labile cell. What do you mean about labile cell? First we have to know what is the meaning of labile. Labile means unstable, consthayi, and we can recall we have many clotting factors in our blood. Factor 5 is called labile factor. It cannot tolerate excess heat or excess cold. It undergoes distraction. So labile cell means it is the unstable cell. The cell আজকে যে সেলটা আমরা দেখতে পাবো হয়তো 7 দিন পর সেই সেলটা নতুন সেল তৈরি হয়েছে ওই জায়গায়। It is called labile cell. What it means? This cell has got power of replication and this cell regularly replicates at an regular interval. It is called labile cell. Example of labile cell, we can say epidermal cell. Epidermal cell. Lining cell of GI tract. Lining cell of urinary tract. Urinary tract, etc. These cells are labile cell. Then stable cell. Stable cell. What is a stable cell? A stable cell has got power of replication, but usually it does not replicate until and unless it is stimulated. On stimulation, it can multiply, it can replicate. Without stimulation, although it has got power of replication, it never multiplies. So, example, hepatocyte. Example is renal tubular cell, etc. Suppose anybody suffers from necrosis in the liver or liver abscess, some hepatocytes undergo destruction, undergo loss. The lost hepatocyte makes a gap within the liver. The liver ultimately, the necrosis is the stimulation for the multiplication of the remaining hepatocytes. The hepatocytes from the reserved cell undergo multiplication and ultimately the gap is filled. So these are the examples of stable cell. The cells can replicate only when stimulated. Stimulation is necrosis or hepatitis. Another is permanent cell. Permanent cell means this cell has got no power of replication. Although you give stimulation, it will never multiply, it will never replicate. Example, neuron. Example, skeletal muscle. Example, cardiac muscle. So these are the permanent cells. Now we want to define, how can we define labile cell from stable cell? We can recall both have power of replication. Labile cell undergoes replication at a regular interval. It requires no extra stimulation. But stable cell has power of replication and replicates only when it is stimulated. Now come to again cellular pathology that I have told you. This is cell, this is nucleus, chromosome, this is the cell organelle in the cytoplasm. So this functionally and structurally normal cell, how can we disturb that cell? The disturbance is called stimulus. So there are many stimulus, there are many stimuli that can stimulate the cell, that can disturb the cell. Now come to what are the stimuli that can stimulate the cell? Stimuli that can stimulate cell. Number one, hypoxia. Again we can say physical agent. Among the physical agents, heat, cold, trauma. Then chemical agent. It includes acid, alkali, then microbial agent, it includes virus, bacteria, fungus, parasite, etc. Then nutritional imbalance. Nutritional imbalance. It may be undernutrition and it may be overnutrition also. Overnutrition. It may be overnutrition. Yes, nutritional imbalance, I have told you, undernutrition and overnutrition. Then immunological reactions. Immunological reactions. And we can say another, genetic derangement. Genetic derangement. Genetic derangement. So these are the different stimulus that can stimulate the cell. First I have told you hypoxia. We know hypoxia means reduction of oxygen. Reduced oxygen is called hypoxia, either in tissue level or in the cellular level. You know, oxygen is mandatory for the cellular functions and function of the tissue. If there is reduction of oxygen in the cellular level, oxidative phosphorylation will be diminished or impaired. There will be cellular sufferings. And I can recall sufferings is nothing but the pathology. Second, physical agent. I have told you heat, cold, trauma. If a man is exposed to heat become in heat cannot be tolerated by the individual. আমরা জানি প্রচণ্ড হিট স্ট্রোকে মানুষ মারা যায়। তার মানে যতটুকু হিট মানুষ সহ্য করতে পারে তার চেয়ে বেশি হিট দিলেই সেল ইনজুরি হবে, সেল আহত হবে, সেল ফাংশন ডিস্টার্বড হবে, আর তাকেই বলছি আমরা সেলুলার সাফারিংস বা প্যাথোলজি। ট্রমাতে তো মানুষের সেলুলার এবং টিস্যু লেভেলে ইনজুরি হবে, প্যাথোলজি হবে। নাও কাম টু কেমিক্যাল এজেন্ট। আমরা বলেছি উই হ্যাভ টোল্ড ইউ অ্যাসিড অ্যান্ড অ্যালকালি। We can say water is neutral, pH 7. Our gastric juice, it is acidic. Again our urine is acidic. You know, if the acidity of gastric juice is diminished, that is the pH of gastric juice or gastric secretion goes towards the alkaline, there will be development of Helicobacter pylori and will lead pathology of stomach. So there is optimum pH of the gastric secretion. Alteration of this acidity, it will produce pathology. Again we can say our urinary tract urine is acidic. Due to acidity of urine, every day we are exposed to E. coli etc. from our vulva, from our perineum etc. etc. The organism may enter in the urinary tract, in the urinary bladder. Due to acidity of urine, the organisms are killed. So if urine become alkaline, there will be urinary tract infection. I have told you microbial agents. তারপরে বলেছি আমরা তোমাকে nutritional imbalance. First one is nutritional deficiency. You know, nutritional deficiency makes many diseases, many sufferings. We can cite an example, deficiency of vitamin A. It will lead to betotic spot, it will lead to keratomalacia etc. etc. night blindness also. Overnutrition, you know, due to overnutrition there will be dyslipidemia, there will be diabetes mellitus, there will be heart diseases, there will be atherosclerosis. I have told you immunological reactions. What it means? It means reaction between antigen and antibody. We can say antigen usually enters in our body, usually. And if antigen enters in our body, there is formation of antibody against it. If we compare the antigen with a thief and we compare the antibody with a policeman, you know a thief and policeman cannot live together. So antigen and antibody cannot live together. There will be reaction, as there is reaction between thief and policeman. So this reaction may occur within the blood vessel, antigen antibody reaction. This reaction is called immunological reaction. So আমরা যদি মনে করি একটা ঘরের মধ্যে অনেক গ্লাস ওয়্যার আছে, সেখানে একটা চোর ঢুকে পড়েছে, আর চোরকে তাড়া করার জন্য পুলিশ ঢুকে পড়েছে। পুলিশ যদি অ্যান্টিবডি হয় আর চোর যদি অ্যান্টিজেন হয়, তো পুলিশ চাইবে চোরটাকে ধরতে, আর চোর চাইবে পুলিশের কাছ থেকে রেস্কিউ পালিয়ে যেতে। এই দুই জায়গায় যখন দুইজনের মধ্যে যখন ধস্তাধস্তি শুরু হবে ঘরের মধ্যে, দেখা যাবে ঘরের দুই একটা গ্লাস ওয়্যার ফার্নিচার ভেঙে গেছে। এই যে ভেঙে গেল, এখানে তো গ্লাস ওয়্যারের কোনো দোষ ছিল না, ওদের দুইজনের রিয়াকশনে ভেঙে গেছে। ঠিক সেই রকম যে আমাদের ভিতরে যদি অ্যান্টিজেন অ্যান্টিবডি রিয়াকশন ইমিউনিটি রিয়াকশন হয়, তখন দেখা যাবে ব্লাড ভেসেল ইনজুরি হতে পারে। ইট ইজ নাথিং বাট সাফারিংস। সো দিস ইজ দিস সাফারিংস or this pathology due to immunological reactions. There are many immunological diseases in our body. Genetic derangement, you know, all the functions, all the activities of a cell is controlled by gene, and there is definite genetic arrangement for its activities. If there is any derangement within the gene, the normal activities of the gene is hampered or stopped. It is called genetic mutation also. So suppose a pair of gene, one come from mother, another come from father. Suppose this is the maternal gene and this is the paternal gene. The two gene is associated with formation of hemoglobin A1. যদি দেখা যায় genetic derangement with this gene, there is mutation, there will be production of hemoglobin, but that hemoglobin will be hemoglobin S. So there will be disease. So this is the genetic derangement. Now come to these are the different stimuli that can stimulate the cell and will develop sufferings or pathology. এখন আমরা দেখব একটা সেলকে যে এতগুলো স্টিমুলেট করা যেতে পারে, এতগুলোর মধ্যে আমরা প্রথমে বলেছি হাইপোক্সিয়া। সাপোজ এ ড্রপ অফ কনসেন্ট্রেটেড হাইড্রোক্লোরিক অ্যাসিড is put in the palm. What will happen? There will be loss of the cell, burning of the cell. Ultimately এটা ফুটা হয়ে বের হয়ে যেতে পারে। এই এতগুলো সেল এখানে ইনজুর্ড হলো, আমরা হাইড্রোক্লোরিক অ্যাসিডকে 1 নম্বরে না বলে I put hypoxia number 1. Why? Because if anybody suffers from heart disease or lung disease that are associated with hypoxia, অনেক লাং ডিজিজ আছে, অনেক হার্ট ডিজিজ আছে যারা শরীরে হাইপোক্সিয়া করতে পারে। তো এরকম একটা ডিজিজ যদি হার্টে হয় অথবা লাংসে হয়, তখন দেখা যাবে বডিতে ফ্রম হেড টু ফুট যত সেল আছে, অল সেলস উইল বি ইনভলভড ডিউ টু হাইপোক্সিয়া। কিন্তু এক জায়গায় যদি হাইড্রোক্লোরিক অ্যাসিড পড়ে, ওইটুকু জায়গায় ইনজুর্ড হবে, কিন্তু আদার সব টিস্যু এবং সেল নর্মাল ফাংশনিং থাকবে, যার জন্য আমরা প্রথমে বলেছি হাইপোক্সিয়া। নাও কাম টু ইফ এ সেল ইজ স্টিমুলেটেড বাই এনি অফ দি স্টিমুলাস, হোয়াট উইল বি রেসপন্সেস অফ দ্য সেল? সেই সেলটা কী কী রেসপন্ড করতে পারে ডিউ টু স্টিমুলাস, এক্সপোজ টু স্টিমুলাস? সো সাপোজ অ্যাগেন দিস ইজ দ্য সেল, the cell is exposed to stimulus, cell is exposed to stimulus. So on exposure to that stimulus, what changes or what the responses of the cell may occur. So now come to cellular responses. To stimulus, কি রেসপন্ড করতে পারে সেল টু স্টিমুলাস? Number 1, cellular adaptation, cellular adaptation, cell injury, cell injury, pathologic calcification, pathologic calcification, subcellular alteration, subcellular alteration, intracellular accumulation, intracellular accumulation, hyaline change, hyaline change, cellular aging, cellular aging. So these are the cellular responses to stimulus. একটা সেলকে যদি আমরা স্টিমুলাস দিয়ে স্টিমুলেট করি তাহলে এগুলোর যে কোনো একটা হইতে পারে সেলুলার রেসপন্সেস। আমরা প্রত্যেকটা আলাদা আলাদা করে দেখব। নাও কাম টু ফার্স্ট সেলুলার অ্যাডাপ্টেশন। সেলুলার অ্যাডাপ্টেশন, অ্যাডাপ্টেশন ইট মিনস খাপ খাইয়ে চলা, খাপ খাইয়ে চলা। একটা সেলকে যদি আমরা স্টিমুলাস দেই, সেলটা যদি সে সহ্য করতে পারে, টলারেট করতে পারে, টলারেট করেই যদি সে তার নর্মাল অ্যাক্টিভিটিস চালিয়ে যেতে পারে, আমরা বলবো সেলটা অ্যাডাপ্টেশন করতে পেরেছে স্টিমুলাসকে। তো নাও কাম টু হোয়াট ইজ সেলুলার অ্যাডাপ্টেশন। Before going to discuss about this, we have to know, suppose this is a normal cell. Normal means both anatomically, physiologically and biochemically this cell is okay, normally functioning cell. If we put stimulus to this cell, আমরা stimulus দিলাম, cell is functioning well, cell is functioning well. Again we put stimulus, the cell is functioning well. Again we put stimulus and at this moment the cell failed to perform its normal activities. So this is the physiologically unstressed cell. This is physiologically unstressed cell. This is physiologically unstressed cell. No stress at this in the cell. So this cell is very much unstressed physiologically. And this is the overstressed cell. Overstressed cell. When the cell is exposed to stressful condition, the cell fails to perform the normal activities. আর একটা সেল যখন তার নর্মাল অ্যাক্টিভিটিস পারফর্ম করতে ফেল করবে, দিস ইজ ডিউ টু প্যাথোলজি অফ দি সেল, দিস ইজ ডিউ টু সাফারিংস অফ দি সেল, অ্যান্ড দিস ইজ নাথিং বাট দি প্যাথোলজি। আমরা একটা এক্সাম্পল সাইড করতে পারি। ইউ আর রানিং উইথ এ হর্স। একটা ঘোড়াকে তুমি পিঠে চড়ে তুমি দৌড়াচ্ছ, আর ঘোড়াকে চাবুক মারছ যে যাচ্ছে সে আরও দৌড় দেয়, ঘোড়া আরও জোরে দৌড়াচ্ছে। আবার চাবুক দিচ্ছ, ঘোড়া যেটা আরও দৌড় দেয়, আবার চাবুক দিচ্ছ, মজা পড়ছে দৌড় দিয়ে, আবার চাবুক দিচ্ছ। এক পর্যায়ে ঘোড়া গিয়ে বসে পড়লো, সে তোমাকে আকার ইঙ্গিতে বুঝায় বলছে, দি বডি ল্যাঙ্গুয়েজ অফ দ্য হর্স তোমাকে আন্ডারস্ট্যান্ড করার চেষ্টা করছে যে আমি আর পারবো না দৌড়েতে। এই যে প্রথম থেকে শেষ পর্যন্ত যে মাঝখানে জায়গাটুকু আমরা বলবো দিস ইজ দি অ্যাডাপ্টেশন অফ দ্য হর্স। এখানে ফিজিওলজিক্যাল আনস্ট্রেস থেকে ওভার স্ট্রেস কন্ডিশন পর্যন্ত মাঝখানে জায়গাটুকু বলবো আমরা সেলুলার অ্যাডাপ্টেশন। সো দিস ইজ দি ওভার স্ট্রেসড প্যাথোলজিক্যাল কন্ডিশন। Pathological condition. So how can we define now cellular adaptation? We can say it is the intermediate state. It is intermediate state between physiologically unstressed and pathologically overstressed condition. So, it is an intermediate state between physiological unstressed and pathologically overstressed condition. এটিকে বলা হয় কি cellular adaptation. It is called cellular adaptation. Cellular adaptation. Now come to what are the different types of cellular adaptation. There are 4 types cellular adaptations, types of cellular adaptation. Number 1, atrophy. Number 2, hypertrophy. Number 3, hyperplasia. And number 4, metaplasia. Metaplasia. Now come to atrophy in details. Atrophy. We are talking about cellular adaptations. First one is the atrophy. Atrophy means acquired diminution of size of cell due to loss of cellular substances. What is this? Acquired diminution of size of cell due to loss of cellular substances is called atrophy. So, it is acquired diminution. তার মানে কি যে এই একটা সেল, suppose the normal cell, this is the nucleus, this is the cytoplasm organelles, and this cytoplasm organelles is nothing but the cellular substances. Suppose mitochondria, endoplasmic reticulum, ribosome, these are the cellular substances, and cytosolic proteins also, all are the cellular substances. এই নর্মাল সেলটা যদি অ্যাকোয়ার্ড ডিমিনিউশন, যদি নর্মাল সেলটা হঠাৎ করে ছোট সাইজ হয়ে যায় লাইক দিস, তখন তাকে বলবো আমরা কি অ্যাট্রফি। তার মানে কি এই সেলটার মধ্যে যত অর্গানেলিস ছিল, সাপোজ দিস সেল হ্যাজ গট রাইবোজম 100, এন্ডোপ্লাজমিক রেটিকুলাম 100, যদি এই সেল থেকে এটা কমে গিয়ে 40 হয়ে থাকে, এটা কমে গিয়ে 30 হয়ে থাকে, তো এখানে 60টা লস, এখানে 70টা লসের ফলে দেখা যাবে সেলটা ছোট হয়ে গেছে, আর এইটাকে বলা হয় cellular atrophy. Or we can compare with this with air-filled balloon. Suppose this is air-filled balloon. The balloon is filled with air. If certain amount of the air from this balloon is withdrawn, what will happen? The size of balloon will be reduced in size. So this is example of atrophy. So you know the membrane of the cell has got elasticity like the balloon, and the organelles like the air. When the amount of organelles is decreased due to elasticity of the cell membrane, it reduced in size to accommodate this. So there is reduction of size, and this is acquired diminution of size of cell due to loss of cellular substances is called atrophy. Now we want to know if atrophy occurs in an organ, what will happen to that organ? The size of the organ will be reduced. So atrophy of cell in an organ leads to reduction of size of an organ. Previously I have told you there are 3 types of cell: labile cell, stable cell and permanent cell. Atrophy may occur in both labile cell, stable cell and permanent cell. Now come to what are the causes of atrophy? What are the causes of atrophy? Causes of atrophy: decreased workload, if the workload of a cell is diminished or reduced by any means, the reduction of the size of a cell. So cause is diminished or decreased workload. Diminished blood supply. Blood supply. If blood supply of an organ is diminished, the cells of that organ undergo atrophy and the organ size is reduced. Diminished hormonal stimulation. Hormonal stimulation. You know, we have many organs that are hormone dependent organ, especially female breast and uterus is hormone dependent organ. You know, in old age, especially after menopause or at menopausal state, the size of breast is diminished and uterus becomes rudimentary. Why? In old ages or after menopause, there is estrogen hormone is diminished. Breast and uterus is the hormone dependent organ. It depends on the estrogen. As there is diminished estrogen in old age, so there is diminished size of this breast and diminished size of the uterus. Denervation. Denervation. You know, poliomyelitis. Poliovirus, it causes poliomyelitis. If anybody suffers from poliomyelitis, we know the anterior horn cell is affected. The anterior horn cell undergo distraction. As the anterior horn cell is distracted, there will be lower motor neural lesion and our lower limb gets no motor supply. There is denervation. So there is atrophy of the muscles of the lower leg, lower limb. Pressure atrophy. Pressure atrophy. You know, if anybody suffers from a huge hydrocele, the hydrocele fluid will exert pressure on the testes and there will be reduction of size of the testes. This is atrophy of the testes due to huge hydrocele. It is due to pressure. Immobilization. If anybody suffers from fracture of bone, suppose anybody suffering from fracture of bones of the forearm, if he or she uses plaster of Paris for long time, especially 1 মাস 1.5 মাস 2 মাস, এরপরে যখন খোলা হবে প্লাস্টারটা দেখা যাবে কম্পেয়ারিং উইথ দ্য আদার হ্যান্ড ওই হাতটা একটু ন্যারো হয়ে গেছে. It is due to atrophy and it is due to immobilization. It is due to immobilization. Non-use atrophy. Non-use atrophy. You know, we have got thymus. After a certain period, the activity of thymus is reduced. So, reduction of use of the thymus, the non-use thymus undergo atrophy. So, these are the different causes of atrophy.
Yes, sir.
Today I feel tired. This is the last part of today's lecture. Inshallah, I will continue this lecture in the next day. Thank you all. আর সবার কাছ থেকে আমি ইনপুট আশা করছি টু ডেভেলপ ইট. থ্যাঙ্কস অ্যাগেন.